Hello, hi, and welcome to this webinar this afternoon, where we're going to be looking at GP Connect and how to connect it up with your digital social care record and the benefits of doing so as well. We're joined today here by two very special guests, Alison Taylor from Edgar Street Residential and Katie from Edgar Street Residential and Alison Taylor from NHS Digitising Social Care. Hi both and welcome.
Hi. Hi, good afternoon. Thank you for joining all.
Great, we're just going to run through a really brief agenda of what we're going to cover today. So my name's Richard. Welcome, I'm from Log My Care here, as the t-shirt may give away. Alison's going to show us through what GP Connect is and understanding the benefits of that. And then I'm going to talk through briefly kind of how to set that up and what the process would be in terms of the National Data Sharing Agreement and getting your ODS code to get set up. And then we're going to hear from Katie on some practical tips and the benefits that they've seen at Edgar Street Residential Home, and then wrap up by having a look at the system and a demo. So I'll hand over to you there, Alison.
Brilliant, thanks. Afternoon, everybody. It's so great to see so many of you on, and thank you for joining. I'm Alison, as Richard said, and I work for NHS England currently, and have been the lead driver for access to information for social care for quite a few years. And obviously we're going to work through this agenda, and if you've got any questions, there's a chat function, and there is people in the background monitoring that as well, so please get your questions in there. So what is GP Connect? So GP Connect, very high level, is access to read-only information within the GP systems. So whatever GP system you use, be it TPP or EMIS, it's information that's lifted from there and displayed within your digital social care record. To see this, you must be CQC registered provider, and you can have access to the restricted view, which, as I say, technically is called HTML, but for us guys it's read only, and the future of interoperability will be read and edit and delete and everything that we would love in the dream world, but it comes slowly, and this is the first step of getting this information out there to you guys to make it real, to be honest. And we've got Katie's story later that's really exciting and brings it to life, really. So there's 3 requisites that you must have. Digital social care record, which is why you're here. Nationally, we've got 18 suppliers now that have done that, so it's great to be here and speaking directly to Log My Care customers who are all social care providers. DSPT, probably heard about that quite a bit, and it's the Data Security Protection Toolkit, and Richard will be talking about that in quite a bit of detail later, but you must have it to standards met, and I'm sure you're either in the process, and there's lots of support out there if you haven't. So and the newest change, to be honest, is the National Data Sharing Agreement that's now digital, and again Richard is going to talk you through that fairly quick process that I've been involved in for many years, and we finally got it live about a year ago, and it's been really powerful because basically you sign it once for your care provider, and then you haven't got to do it again. You still follow all the same processes that you follow with your organisation, but if there's any questions on that, once Richard's been through it, we can pick it up at the end, because IG has been my nemesis for about 10 years, and we're over them barriers now. It really is safe to share and access this information, which is quite exciting. I've got to remember to press the button, and the arrows disappeared, Richard. Okay, got it back. Okay, so who can access it? So what we did about 3 or 4 years ago was look at GP Connect Access, because it was only available to clinicians during COVID, and we know that the power of information is really, really vital for everybody working in this landscape. And having a look at it, being a nurse, unless you've had really good background and experience with GP systems, it's quite overwhelming, the information that you get for the clinical record when you're first starting to trawl through this medical information as such. So we created what's called the filtered access, and what that gives you is a summary view of the information that's recent and up to date. It's the last 3 encounters from the practice, so that can be any healthcare professional that's logged that information. You get that information, the active problems, immunisations, medications and allergies, all that you'll see later when Richard again demos the system and brings it to life, really. The roles that are on there are all role-based access control. That's what RBAC stands for. Marking my own slide because I realise there's quite a few acronyms in there. But what it means is you can have control locally over who sees what because of the jobs you're doing. And many people call these positions different things. For example, some people don't have senior carers, they just have carer or they have a care manager. So it's up to you to work with your supplier, being Log My Care, and working this out. But it's really at your control and it's configurable to access this information for the people that you care for. I need to move on. I keep losing sorry guys, I keep losing the arrows, so apologies, just bear with me. Okay, so system benefits, there's lots of benefits, but obviously as a nurse working out there still for many years, I've got a shift tomorrow. The biggest one that comes to mind is phone calls. The reduction in phone calls chasing meds information is just huge, and across several stakeholders, the GP, the pharmacy, the hospital discharge team, the bed managers, anyone that you're trying to get up-to-date information about meds. I think that's the biggest thing for me personally. Residents tell me as well it's nice not to have to repeat their information. That's a big one. And this slide will be shared afterwards, and I'm sure you guys already being on the call know some of these benefits, which is why you want to get this access and get on with your jobs, which it really hopefully will reduce the burden. So my next slide, I need an arrow. So hear from you guys, all the testimonials over the years, or just a few to be fair, that I could put on a slide. And yeah, not calling for information is a big one for everybody, but there's a few on there that are great. But the one that I like is that people don't feel that they're a burden. They're empowered to get the information and can get on with their everyday tasks, which is what we're all about on that shop floor, and caring for our residents. Implementation data, just numbers. People like numbers. I've been working on this program for a long time. Over the last couple of years, you can see we've really improved the adoption because many suppliers have now onboarded, working with all the suppliers, doing these webinars. I hope by the end of this year, we've got about 70% of care providers accessing GP Connect because that's how many people out there have got digital social care records. So nationally, we're just striving to share that information and get an adoption of care providers accessing this information. The bit for me at the end, the 22,000 unique use staff coming to digital, ticks all other boxes that you guys work with, like workforce and challenges and things like that. So the fact that they're empowered to use it back to their role and use that information is really, really key. And I do a lot of work with stakeholders in workforce because we know how vital that is, and underpins a lot of this stuff. I think I'm over to you, Richard.
Fab, thanks, Alison. So yeah, importantly, as Alison said, it's really vital that we understand what the National Data Sharing Agreement is and how to ultimately access GP Connect via your digital social care record. So the first question to answer is, what is the NDSA? It's a signed contract which details acceptable use of data by GP Connect users, you. It ultimately ensures secure sharing of patient records. As Alison was saying, that's obviously paramount, has been a challenge over the last 10 or so years, but we're certainly there now. So the data that's being shared from the GP surgeries to the GP Connect products to your digital social care platform like Log My Care is going to be linked up and totally secure going forward. So what are the requirements to access GP Connect? You need to have accepted the terms of the NDSA and have a current DSPT submission, which has been certified as the standards having been met. You also need to adhere to data protection laws and use GP Connect only for direct care. And finally, as was asked in the questions a little earlier here, you also do need to be CQC registered, because ultimately you need an ODS code, which is what we're going to get onto next. That's part of your application process. So you need to provide your GP Connect software name and your ODS code in order to get started and connect up Log My Care to GP Connect. Now you can either look up your ODS code or use using the ODS data search and export portal, or you can request one as well through the National NHS IT Customer Support Portal. And we do have guidance on this, and that can be found in our LMC Support Hub article specifically for GP Connect, which we'll share at the end of the webinar. You also need to state the reason for you using GP Connect and confirm that NDSA agreement is in place. And then last but not least, you also need to submit the details of your signatory. So the DSCR role in this, it needs to obviously be an assured solution, as Log My Care is. It's then awarded Connected Systems Assurance by NHS Digital, and we will take it from there with your NDSA that's been signed and your ODS code that you provide us to set your service up with GP Connect. Again, that's all in our support article, which we'll share step-by-step guidance on. So the next step for you guys after this would be to visit your GP Connect info hub and apply through the NHS portal if you haven't done so already, and then connect your DSCR solution and reach out to us for assistance with the activation there. I know those are a lot of steps, but we do have a full article again, which we'll share afterwards, just to break that down. And it is really straightforward when you take it bit by bit. So I'm going to hand over next to Katie, who's going to tell us a little bit about her story as a customer using GP Connect with Log My Care.
Thank you. Hello, my name's Katie Barnes and I'm the area manager for Edgar Street Residential Home. We're a small home for people with learning disabilities. I previously used GP Connect in other services with other providers. So I was really welcoming Log My Care onboarding with GP Connect access. So I think I was one of the first people to do the onboarding. It sounds very technical from you, and I'm not being making it sound dreadful. There's a lot of acronyms, but actually it's really very simple. A lot of us have already got NHS mail, and a lot of us have already done the data security toolkit, so that's already part of your normal routine. If that is, then it's already in place. You already have an ODS code, you just probably don't know that you've got it. It is connected with your NHS mail. If you go into your settings through there, you can just see it visually on there. So it's dead simple to find that. Clicking that into all the acronyms that you've just said into, and the onboarding is that simple. It links up. The sharing data set tool is a click and a signature to say that you're happy to do it. It is so, I can't stress enough how technical it sounds, but how simple it really very is. And before you know it, you're onboarded and you're aware. Obviously, you've got to get all your consent from the people that you support. That's really important, which is what we had to do to then get all the consents logged and pull that all in line. But then once we got all the consents in and the codes were all lined up, we were on and raring to go, and it was there, readily available for us.
Thanks so much, Katie. And yeah, as you say, it is obviously a lot simpler than I made it sound there. Yeah. And it's great that you've had that experience, that it was really straightforward to get started. I had a couple of questions I just wanted to run by you on your experience kind of getting set up using GP Connect. Firstly, I just wanted to understand a bit more about what motivated your organisation to implement GP Connect through Log My Care.
Well, most providers will sympathise with the time-consuming element of having any conversation with any GP or receptionist, actually. And it is so time-consuming. As I said, I've used it before in another service, so I did know the benefits already. So I was really welcomed Log My Care getting involved in it. It does save so much time. Family really enjoy it because you can show family on the on your laptop and show them everything that's coming through. When the blood results are coming through, for instance, they can see it in real time. Stuff like when we've a UTI, sending a urine sample off, and then we can get it before the GP has even actioned it because it's already on the system because it comes through from the labs. So that's quite something that's quite good for us. Changes in medication history. Just if you get a person coming into your service that has got no family or very little information, which happens, not all the time, but does happen, medication summaries, that just doesn't come with your person. The person doesn't know their medical history. That being on there and just being readily available to be able to see, allergies to any medication that is vital that straight away. Medical issues that have been forgotten but are still something that we very much need to know. You can see in real time, so that's good. So getting a prescription issued and having to phone up for hours on end, being on with the silly music playing in the background, not having to listen to that because you can just log on and see it quickly. That stuff's real. The time consuming stuff is phenomenally faster, so that's great for us.
Yeah, awesome. It sounds like it's had a big impact.
Huge.
Yeah, what kind of changes have you seen in kind of day-to-day care delivery as a result of using GP Connect?
Just mainly time-saving exercise. Everything's so time-consuming. The speed of which we can support people effectively without having to spend so much time waiting on the phone. We've got lots and lots of information readily available to us at a fast pace, and be able to share it. So particularly at Edgar Street Residential Home, the people with learning disabilities got some capacities to understand certain information, and you can share that with them. You can see it on there rather than having to physically be making an appointment, going to see a GP, waiting for a prescription to be issued for hours on end, chasing up medication, chasing up how many medication you need. You can see it all on there, readily available to you straight away with a click.
Yeah, so it sounds as though I know the answer to what this might be, but what advice would you give to any services that are considering taking up GP Connect with Log My Care?
Well, it's just not. It's not a no-brainer. It's not really for a discussion, is it? It's free, readily available, free information that you need right now, isn't it? We've got to engage in that because we've wanted it for so long to work in a collaborative working, and it's just a way that you can do it, and it's there. It's information that should have been shared with us for a very long time, and just almost that it's a must, isn't it? Why would you not have it? It would be the question, the counter question, really.
Yeah, 100% agree with you, especially given all that you said about how simple and straightforward it is to get it set up in the first place. Fab, well, thank you so much for telling us a bit about your experiences using the system and getting it set up. We've had some people in the chat there who are really keen to take a closer look at the product and GP Connect in action in Log My Care. So that's exactly what we're going to do next. So this is my demo environment here with Mike, one of our clients, one of our service users. We've had some comments and questions about consent as well. Obviously, really, really important when we're looking at handling and accessing sensitive personal information like this. And there is going to be a consent form set up as a template, as you have for other things already, to care and treatment, to medication administration, etc. And again, this can be edited as you need to as well. But we have a standard template here for you to use and to gather somebody's signature for this. And as with all of the consent forms in Log My Care, we're always looking at capacity and ability to sign and consent. And if we're answering no to either of those options, we'd be referred to someone who has power of attorney could sign on behalf of Mike, or if there isn't anyone who has power of attorney in some cases, we can list out somebody and exactly why they're signing on Mike's behalf, what their relationship is to Mike here. Once we have that in place and signed, this is what GP Connect is going to look like once we enter Mike's NHS number. So just as Katie was saying, there's loads and loads of information here right at your fingertips, immediately available. Everything from vaccination records, medications prescribed, previous observations and visits to GPs. And just to answer another question, I think Alison did get to this one. It is specifically for GP surgeries rather than hospitals, but there is some work being done at the moment to kind of scope and test an integration with hospitals as well for further down the line for the future. But yeah, you can see how well integrated and available this information is. It's obviously protected in terms of who can have access to this and who doesn't. So you need to select the individuals that should have access to all of this information. And there will be different tiers within that as well in terms of full access or partial access to some of this information. As I said, there is a full article, a full guide that we have set up here around GP Connect, which will help you with getting this set up and getting started. So you really simply come in and search for that, and then it has the step-by-step guide on what you need to do, the things that I talked through a moment ago to have access to all of this data, to all this information. So yeah, I hope that's been really helpful to everyone today, having a bit of a closer look at what GP Connect would look like. You can see here with Arnold, not just Mike, we've got that set up. And again, that data is pulling through automatically and updating. So no more time spent on the phone listening to those dial tones. As Katie was saying, it's just there at your fingertips, ready for you when you need to access this. Fabulous. Just coming back to the chat here, to the webinar, we were going to wrap up. But before we did, I just wanted to flag this up. If you're already using Log My Care, again, there's the support article. If you're not using Log My Care, if you're not signed up with us, here's where you can book in your one-to-one demo to find out more about the platform and to obviously look at GP Connect with us and how we can help you set that up when you do onboard and get started with us. I'm just going to throw over to the chat now. So it looks like we've got quite a few questions. So if we start having a quick look through these, where are we up to? If we go to Alan Hiskett at the top here. Alison, do you know the CHIE? We've been going through a lot of acronyms today. It says, is it a more accessible version of CHIE?
Is that the Child Health Integration Engine, Alan? I'm not sure what CHIE.
No, we'll ask him to elaborate on that.
Well, if it is that, then it's not anything to do with chi in that way.
Sure. Okay. And we've got Janet here asking whether it's connected to the service user's GP. So it would identify, yeah, of course, the integration pulls through directly from the person's GP by recognizing their identifier, their NHS number. Got one from here from Jason. Currently, when ambulance comes, we supply them with GP care plan summary, which the GP surgery have supplied us with. Is this possible to print from the GP Connect section?
Yeah.
You can have that one, Katie.
Yeah, so you can do. I mean, the one that's been supplied by the GP surgery is only live on that day that it's printed, so it's no good. In my homes, I would say that. What you guys do in yours is up to you, but we always go off the most live and up-to-date information. So we would print on the day of admission when the ambulance is called. You can print anything from GP Connect. So just as one that we have just done, I wanted to do a medical history for someone since 2003 for medicines that she'd used or antipsychotic, and it was the biggest breakthrough to get that information, because all the clinical psychologists and psychiatrists involved with this particular lady was not able to get the information as fast as I could from GP Connect.
There you go. You're more empowered than the healthcare professionals.
And it's the first time ever.
Yeah.
That's amazing. We had one here from Vanessa. Is the medical history merged from the GP surgery, or do we need to put this in ourselves?
This is the GP's information. So what you're getting is the GP's information. So the answer is yes.
And all the paperwork, when they used to be on paper-based GP, is all on there.
Yeah, awesome. David's asked, how do we enable this? David, as part of the follow-up from this, we'll get that support article, that help article out to everyone who's attended today, so it's easily accessible, showing those steps to get you set up and running with GP Connect on Love My Care.
Care Health Information Exchange has just answered your call, your CHIE, Care and Health Information Exchange.
Yes, it will be linked up in the future. There's a roadmap, but currently this is directly via the assured suppliers. There's a bigger interoperability plan, but the scope for this work is supplier to provider.
Yeah. Fab, and just to answer Stephanie's question, there is no extra cost to using GP Connect. There isn't for any platform. That's one of the stipulations to this feature, this capability. Monica's asked, how and where do they sign the National Data Sharing Agreement? Where do they get hold of that, Alison?
It's in the PowerPoint. When you talk through it, it's actually in the PowerPoint. So when you share this, people will be able to go back and watch it and obviously get the details along with the slides. So if you Google it, you'll get the NHS up. So, but we actually do supply you with the information after the webinar.
Yeah, and someone from Log My Care helped me as well. It was really simple, click and go.
Yeah, awesome. I think that was pretty much all the questions we had. There was just one around consent. If you had experienced this before, Vanessa, how have you managed the process where someone has opted out or decided not to consent?
Well, Alison, do you want to answer it, or shall I give a
fine. Depends, because at the GPN, this is where they control actual proper legal consent for the legal basis. So if a patient decides to opt out, the GP record won't be available. And when you search for that resident, it'll just tell you, sorry, computer says no. However, them consents are normally quite old, pre-care and pre-coming into your care setting. So I've dealt with that by going and having another conversation with the family and just refreshing the fact that 10 years ago, didn't need to give access now to improve care and all those benefits that you know around accessing to information. And I don't think I've had any to date that haven't turned that around by just having that conversation with the relatives and residents. Because nationally, there's less than 1% of people that opt out of sharing their information. And this isn't confidential, sensitive information. This is a summary information for everyday care. So it's not complex at the moment. It's just basic. So, yeah, I would just have those normal conversations and just tell them why you're doing it. And generally, you'll spin that around. And then when you then they call it for information back, then you'll get the information where the computer says yes, because that consent at the GPN needs to be changed. Log My Care can't do anything about that, as you can't. It is speaking to your GP practice once you've updated that information and saying we've spoken to the family, etc., please open the consent. And whether you do that via email or via a conversation, however you communicate normally with your practice, I would say. And if you haven't got a good relationship with your practice, because I've also experienced that, try and build one. Maybe the home manager, the admin, just somebody who really wants to support you. It's that human behaviour, and go and visit them and take cakes. This was pre-COVID days, So yeah, you can always get normally people in the right space if you explain what's going on. You've just put yourself on mute, Katie.
Sorry.
Was you going to say something?
No, I was just going to say the difference when a person's supported declines is harder, but the knowledge within is what gets you through. So some relatives are really worried and scared about AI. Well, so is the rest of the world, but you know, it's something that we just have to get on with. And I think that once you get through to somebody that knowledge is power over the information that's shared, and that you understand what the use is for, that it's not just to access all everybody's information and be nosy on their medical stuff. It is to provide a good quality service to that person individually in a person-centered way. I think once you get them around that's really good. But yes, we had to do all the consents before we could even, it would give any access on Log My Care.
Yeah, and that answers one of the questions we had there, just that yes, you would need consent from each patient, each service user who you wanted to set GP Connect up for. Finally, last one I wanted to answer here with Jason again was just to say that yes, the GP Connect menu is totally separate from the other care information that you have held in Log My Care, and it certainly wouldn't merge or pull that data into your care plans. And yes, to answer Lloyd as well, it's a read-only connection to those customers' data, exactly, and their records.
No, you can't book a GP appointment. Damn it. Wouldn't that be marvellous?
Yeah, and it is one way, exactly. I think I've had some people ask me in the past, will GPs be able to see our data? No, it's just you accessing the data held by
it will eventually, though. I have to come in there. Absolutely. Okay. For sharing information is both ways. Absolutely. Yeah. So, but it's quite a way off, but absolutely be prepared in the future to share your information. It's powerful and it drives change within secondary care and primary care.
With the care plans, won't it?
So we need to share that information and share our care plans, and definitely the Digitising Social Care programme is looking at that interoperability platform now. So the future will be information both ways, but basics at the minute, read only, one way.
Yeah. And it'll probably be read only to our care plans eventually, won't it?
Yeah, start read only.
Which would be great. You know, what does your care plan say? Go and read it. It'll be brilliant. Yes.
Exactly. Done all this work, go and read about your patient.
Yeah.
Fab. And just very, very last one to answer. Yes, Monica, the consent and the signatures need to be uploaded to the system. So the consent form that we showed you there, that we flagged up, needs to be signed, and that would just evidence that you do have the consent from that individual to set up GP Connect on their behalf. Fab. Well, thank you so much, Katie. Thanks, Alison, for joining us today and sharing your insights and your knowledge with us. It's been an absolute pleasure. And I hope everyone's feeling more confident about the next steps they need to take to get onto GP Connect and get access there.
Hopefully, we'll go mad, and I'll look forward to seeing provider adoption. Yeah, definitely.
Yeah, it'll be all down to you two.
Collaborative working. This is what it's all about.
And the work you've done at Log My Care to get here.
Yeah.
Lots of development, lots of costs that your customers probably don't know about. So it's an achievement. You've really put a lot into this, and your customers need to benefit off of it. That's the whole idea. So good luck with it all. I really hope I see people accessing it. And thank you for inviting us today.
Yeah, thank you.
Thanks, guys. Take care.
See you later. Bye.
See ya.